Hello, Gaston County. Welcome to episode number 142, I think, of Gaston's Great, a podcast highlighting some of the great things happening in and around Gaston County. I'm your host, Stephen Long. We are coming to you once again from the worldwide headquarters of GSM Services. We seem to believe in discussing more of the reasons why Gaston's great. We are highlighting another great organization this week as we highlight HealthNet Gaston. We have Crystal Walls and Barbie McMacken with us today. Crystal is the executive director, and Barbie is the HealthNet Gaston continuum of, that's a tough word for me to say, I'm sorry, of care program supervisor. So Crystal and Barbie, it's great to have you on, and welcome to the podcast.
Thank you for having us.
Yeah, thanks for having us.
You're very welcome. And just real quick, I'm going to make a note here that if you heard, I said episode 142. So apparently for the last 20-some episodes, I've been saying the wrong number. I've been saying one number behind, so we are actually episode 142, not 141, which I have written on my paper. So Naomi straightened me out this week to get the numbers right. So, sorry, just a little housekeeping there. If you're wondering why I've been off for so long. So, something we like to do at the very beginning, and Barbie, we'll start with you. Just tell us, before we get into the specifics of HealthNet Gaston, just tell us a little bit about yourself, anything that you would like to share.
Yes, I've been married for 25 years to my husband, Jamie. We have 3 children and 3 grandchildren and one on the way.
Wow.
I'll be here in February.
Okay.
And I have dedicated the majority of my work career in Gaston County. I do live in York County, but
we won't hold that against you.
Just right across the line. It's quicker for me to come here than it is to go anywhere else in York County. So.
Oh yeah, well I mean, listen, we do a lot of work day to day in York County. A lot of coworkers that live in York County as well. So it's a great area. Crystal, what about you?
So I actually grew up in Cleveland County.
Okay.
But I've been in Gaston County now for about 10 years. I'm married to Chesley Walls. We live in Cherville, if we want to say it the correct way.
That's correct. You've been here long enough to say it properly.
Yeah. I have 3 children, Lane, Katie, and Brent. Lane just graduated from App State.
He's very good.
Works in cybersecurity.
Oh,
he just
cool.
got married, too, about a month ago.
Wow.
And
That's
then,
2 big things.
I know.
Yeah.
Brent is at Western Carolina University. He's a graduate from Wingate, but he's getting his master's at Western Carolina. And he plays baseball for them too.
Oh, wow.
Yeah.
That's cool. I'm a big baseball guy.
Yeah.
That's awesome.
And then Kate lives in Gastonia, and she is a paralegal.
Okay, cool.
Yeah.
So just real quick, my middle child, Hannah, who works here part-time, graduated from App 2 years ago.
Okay.
And my son graduated from Western Carolina in 2022.
Yeah.
So they were a year apart. So yeah, as a matter of fact,
Nice.
We love Western and App.
I know. Me too.
My wife and I are going this weekend to spend a little time at Western because we haven't in 2 or 3 years since he graduated. So
It was homecoming last weekend, weekend before, so we were up there.
Yeah, so that's cool. Love that area.
Yeah.
So anyway, the point here is for us to learn and talk about HealthNet Gaston. So first question, of course, we have some listeners. We probably have listeners who have heard of it or know about it, but they might not really know exactly what HealthNet Gaston is. So Crystal, I'll just start with you, and Barbie, you can chime in after if she messes anything up on her explanation. But Crystal, just kind of share with our listeners what is HealthNet Gaston, and just give a little insight there, the mission, or just anything you'd like to share about, so our listeners can understand a little better.
So HealthNet Gaston is a collaborative care network for uninsured patients of Gaston County who have chronic health conditions. You have to be 18 years or older and 200% federal poverty level.
Okay.
So we partner with Caramount Health to see our patients at no cost, specialty care. They get surgery, medications. So really, we provide access to health care. We're also, HealthNet is the lead agency for the continuum of care, which Barbie supervises the programs under the continuum of care. And continuum of care works with the homeless population. So we have street outreach. So we're able to go out into the community to provide services for the homeless population. We have a mobile street outreach unit. We're able to drive around. So that's basically what we do.
That's interesting. I've had 2 stints on the United Way board, and was a United Way chair, and United Way used to be the lead organization for that, because that's been a while.
Yes.
So maybe let's go ahead and Barbie, can you just, before we get back to the healthcare side, can you go ahead and talk maybe a little bit about what specifically you're doing and what the continuum of care is? 'Cause I'll guarantee you there's not many, I shouldn't say guaranteed, but there, not as many listeners are going to know what that is.
You're
And
right.
the work that's done and how big of a, well, frankly, how big of a deal that is for our area.
It is a big deal. Actually, it's a number of agencies within the Gaston, Lincoln, and Cleveland counties. It's a tri-county continuum of care. And it's agencies that participate connecting the homeless to services. Could be health care, could be housing, could be mental health care. It could be substance abuse. We rely on one another actually to surround ourselves around the folks who are homeless and who need that extra attention to live sustainable lives.
We've had, over the years because if you go back 3.5 years, our first episode was March of 2021. So we were exactly a year after COVID started.
Don't say that loud, yeah.
Yeah, we don't like to use that word anymore. Maybe we could be stricken from the vocabulary forever. But so some of the organizations we've talked with have some connection to the homelessness or unsheltered community here. Is your experience the same? Is that seemingly since, and I'm no expert on it, so bear with me with this question, seemingly since COVID, the need for those services has seemed to expand some? Has the homelessness increased, our numbers here, or is that just seem like it because we have two offices, one here and one in West Gastonia? Is it just because they're more visible, or have you seen more need for the services that and help that you're providing?
Short answer is yes.
Okay. It's probably never that simple, though.
That's true.
Gotcha.
Short answer is yes. It is a very big issue here in Gaston County and in Lincoln and Cleveland County as well. But Gaston County is a little bit larger than those two counties combined. I think affordable housing, quote unquote, is a big issue.
Okay.
And so the number has grown, but we are doing everything that we can to shrink that number. And I think that it's going to be an issue until everybody jumps in the ditches with us and surrounds
together.
ourselves. Mm-hmm.
Yeah, this wasn't planned, but the episode we released last week was Our Neighbors, Inc. with Stephen Crane, and who is, that's their big mission is about affordable housing.
Correct.
Basically, again, that was something I was totally unaware of some of the stats he shared. I mean,
He's part of our COC.
He is.
Okay.
Well, he's
good.
great, yeah. But another thing, too, just to piggyback on what Barbie was saying, we don't have an emergency shelter right now.
Mm-hmm.
So that's another reason why we're probably seeing an increase, out in the community, past, coming here.
is this going to be the first winter that we've gone through without one?
Yes.
Yes.
Officially without one?
Yes.
Okay.
Yeah. And hopefully we'll be able to do a cold weather shelter.
Yeah.
That's in the works. So
Because it seemed to me it would be different. Winter's different than summer.
Yeah,
or
it is.
the seasons, right?
Definitely. Yeah.
Even though we seem to dislike hot weather more in general, cold weather's more dangerous
It
in
is.
general.
And one thing that I've noticed that within the last couple of years, a good thing is that we haven't had such harsh winters that
True.
it is, completely, of course I can say this because I'm in a home,
Right.
completely unbearable.
Our perspective is different.
Correct. But, snow is a big issue, and we haven't had any in the last couple of years. So that is a plus if
Sure.
we can count it a plus.
Sure.
We do lean heavily on generosity of folks. And like Crystal said, we're working on getting cold weather shelter set up for this year, especially since the homeless shelter has
Right.
absolved their homeless shelter side. The
Gotcha.
Salvation Army still does services, but they just
Not the shelter
not
specifically.
the shelter part. Yes.
All right, so you may have already answered this question, but I'm going to ask it again. So just if there's nothing else to add, we'll go on to the next one. But you share a little bit about initiatives and things that you're doing. Is there any more detail there, or more initiative that you haven't mentioned that you guys are doing? Is it strictly the couple of things that we've talked about already?
So we do have a program where we're able to provide housing
Okay.
for some of the homeless population or underserved population, I would say. We have some grant money through Emergency Solutions Grant and state fiscal recovery funds, which was COVID money. So we are able to provide rental assistance, deposits, things like that.
Okay.
So that's one thing we're doing too. We have a housing navigator. Recently, we just received a grant through HUD that circles around creating a response system for youth, homeless youth. So we're working on that. That's actually involving 20 counties, some of those in western North Carolina. So that's a new focus that we're working on. So we're excited about that. We're just getting started with it.
All right.
So.
And if I may say, HUD determines youth as a little bit different. When we think of youth, we think of under the age of 18. HUD standards, youth is up to, 24.
Okay.
So
That's interesting.
Yeah.
I didn't know that.
Mm-hmm. So it's not just for those who are under the age of 18. It could be up to the age of 24.
Okay. So a question that we like to ask is just thinking back on your time with HealthNet Gaston, or some successes, a story about, wow, you saw a family impacted or an individual impact. You said, well, this is the reason why we're here, and this really is the mission. You see the mission being played out. Any specific examples you can think of? Well, I mean, obviously without sharing any specifics of individuals, but anything you can share their successes or what you're most proud of seeing accomplished?
Yeah, I mean, there's a lot. Really housing
sure.
these, but they've been some that, for instance, one example, there was a person that didn't speak English at all.
Okay.
She was in a park, didn't really know where to go. Somehow she got in touch with us. Her husband came here too to work construction for a company. She didn't know where he was at the time, but she called us. We had our team go out we somehow figured out where she was. We were asking her about her surroundings. We were able to locate her, go to her car. She had small children with her.
Oh, wow.
They didn't have any food. So we were able to provide them with food, call a partner hotel, and was able to get her family into a hotel for around 30 days until we were able to house them successfully, But they have to be able to have sustainability.
Sure.
They have to have some income, and they did. But yeah, I mean, it's just the process. They were homeless. They didn't have anywhere to go, no food, so we were able to provide them with those resources and then actually house them in permanent supportive housing.
See, I'm sure that kind of stuff.
Yeah.
I don't know how often that would happen, but that's a great story,
Yeah.
right?
And then too, I guess I'd like to say, I'm proud of how we do partner with Caramont and their ED utilization with our patients that are on our program. ED utilization, inpatient hospitalizations, all of that has decreased. So we track all of that data and report it. But that's another success that we've.
Barbie, what about you? Barbie, anything that comes to your mind about the area you're kind of focused on?
I think that we have been able to help those who have been playing the system for quite some time.
Okay.
So we've been able to open doors that they couldn't when they were meeting resistance. So we were able to open those doors for them. And one gentleman comes into my mind. He had been fighting the system for so long, and his sister was helping him, and they just did not know where to turn. And they finally got in touch with our housing navigator. And she found him an apartment, helped him get furnishings for the apartment. His biggest thing was that he had a dog, and a lot of apartment complexes don't allow you to have animals,
Right.
but she was able to find him an apartment that allowed animals, and it was just a great story, and the gratitude that comes our way, because our folks have met this resistance and been told no so much that when they finally get told yes, their emotions run wild. And, that's...
They don't know how to react.
I think the
bet.
doggy was just as happy
Absolutely.
as he was.
Yeah.
We did a story on them and shared it.
Okay.
But yeah.
And HealthNet Gaston, see, I came to HealthNet Gaston, I'm in my 10th year, and I started off as a medication assistance person, which
Okay.
meant that I would help people get their medicines. They couldn't afford them and such. The growth that has come through these past 10 years in the HealthNet Gaston program, and becoming the lead agency for the continuum of care, is just amazing. Not only do we get to still do the little nuances of
Right.
how HealthNet Gaston started, but so much more. Realizing that getting medications to someone who is homeless, making sure that they're getting healthier, gives them the opportunity to perhaps get a job, to perhaps get an income, to perhaps get into housing, and just connecting from zero and getting them at 100%.
Focusing on like the social drivers of health, social determinants of health is what it used to be called. That's really our focus. So we're able to, I guess, focus on the whole person,
Right.
because those things really affect your health. And
Well, sure.
so
How do y'all get connected with these individuals, or how do they find you typically? I mean, is it the collaboration with organizations like Caramont, or collaboration with other organizations? How do they? You mentioned a couple times where they found you, or they heard about you, or they connected with you. How does that typically occur, or is it just all kinds of different ways?
primary care offices
Okay.
refer to us if they come in, if they're uninsured or they just need services in general. Outreach events.
Outreach of his mobile unit. Now that we have the
Okay.
mobile unit goes out twice a
Yeah.
week to different locations on Tuesdays and Thursdays.
We manage the laundry shower unit that Gaston County purchased. I don't know if you guys are familiar with that.
I am.
It just
I've heard of
started.
it, yeah.
Yeah,
Yeah,
so
yeah.
we manage that.
Okay, that's
so
cool.
We've been at Bountiful Blessings every Thursday for about a month now.
Oh,
so a
yeah.
lot of contacts there.
Yeah, Bountiful Blessings has been a 2-time guest on here, and that's a great group, great organization, what they're doing.
And I think the biggest thing is word of mouth.
Yeah.
Because when one or two people get helped, they're telling everybody, and then they're telling everybody, and then they're telling everybody. And the word of mouth, even though HealthNet Gaston has been out there for years, it is
2007.
yes, it's just amazing how word of mouth
Oh, sure.
is.
Yeah.
I think that's our number one.
And that typically is, I think, for most things, probably is you help somebody and they're involved or interacting with somebody who needs the same type of help or something. And how did that happen? And they're going to pass that along.
We've had some walk-ins. They'll come in and we'll give them a backpack full of like snacks, food, items, information about health care, maybe get them enrolled in Medicaid if they qualify. And then a little bit later, we'll have somebody else come because they went and told their friends down
Sure.
the street,
Yeah.
in the homeless population. So it's like they communicate that way too.
Something I didn't even mention and think about, but correct me if I'm wrong here, but HealthNet Gaston is it correct? Call it's part of Contegra Health. Is that right?
So we're our own nonprofit.
Okay.
Our own board. I have my own board, but we pay Contegra for services, and they actually help fund us as well
Understood.
with some grant money.
Understood.
But
Okay.
yeah, so we pay them for like IT services, human resources.
Gotcha.
We're Contegra employees, but still
Understood.
HealthNet, yeah,
Okay, so there's a connection there, but it's not
Yes.
as
exactly
being a part of it isn't really the best description.
right.
Okay.
Right.
So the question we typically ask, and used to ask this question: how do you envision the organization looking like in 5 to 10 years? But I don't know about your world, but I know the world like we live in here. 5 to 10 years is too long nowadays. Things change so fast. We might look out 3 years. Even that can change so quickly. But what do you envision the organization looking like, or any plans, long term, or is it just trying to serve more people, or whatever the case may be? Anything?
Sustainability, applying for additional funding to add in some different resources. I would like to help clients be able to help them with employment, interview, like training, things like that. And then I guess just expanding our resources, having additional funds to help more people as far as housing, rental assistance, things like that.
I agree. I think especially with the COC, that we are working towards just housing stability.
Ending homelessness.
Yes, ending that homelessness. And because everybody has a right to live under shelter versus living under a blanket or under a tent, or and that's
Everybody deserves a warm bed.
This might be an unfair question, but I'm going to ask anyway. Sorry. In your experience dealing with the unsheltered community, is there a percentage that I realize this is guess because I have some guesses with my experience in 30 years working in West Gastonia. In fact, I was born in West Gastonia, grew up in church in West Gastonia. What percentage, how would it split up between the unsheltered who something bad's happened, again, I'm no expert, mental health related, versus that's what I believe is a super small percentage that decide to live that way. That's just my personal experience. There's a percentage, but my experience is super small with my interactions and being on United Way board, Gaston Together board, these organizations that I've had the opportunity to go out into the community on occasion and kind of see that. Is that a fair question, or?
It is a fair question, but first of all, I would not think that the percentage is high at all. I think it's just a very, very low percentage. I don't think anybody prefers to be homeless.
Okay, that's fair.
I think that, life happens. When you're living paycheck to paycheck, I think that has a lot to do with it. And
sure.
There's something, and it can be something small. It doesn't have to be a big life change.
Right, yeah. Especially with the changes in cost of living the last few years.
Yeah, but those, I think that, there very well may be people who do choose to live off grid.
Maybe the lifestyle, it might be a better word for that.
There's some that don't want help, and they'll tell you.
Maybe that's a better way to do it.
They just want some resources, but they don't. Yeah. Some are fine.
They don't want the next step that you can help with.
Mm-hmm.
But like Barbie said, it is a very small.
Yeah, I absolutely.
Yeah. But mental health plays a huge role in it.
Yeah.
That's probably the biggest reason that things like that happen. But then you can have somebody that's executive director, president of a company, and something happens. Maybe they go through a divorce, or other life changing things happen, and that's just how they end up.
Well, I think Stephen Crane quoted, if I had to go back to be sure, but I think he quoted low $20 an hour just to be able to afford a family of 3, maybe an apartment around here.
And that's lucky.
Yeah.
And that's being lucky.
Minimum. So, yeah.
They're our lowest. We've found some around 900 for individual landlords, private landlords. Most of the time it's 1,200, maybe something like that, or higher.
Yeah.
As far as rent.
All right. So I mean, ideally, organizations like yours, all the good work you're doing, it'd be nice one day to not need the organization, right? But
work
that's
ourselves out of a job.
yeah. I don't see that. I don't see that occurring ever, unfortunately.
Well, too, with Medicaid expansion, we've had to kind of restructure some things. So now we can help patients enroll in Medicaid. We have navigators through the Affordable Care Act, and so they're able to enroll in ACA because there's a gap. There is a small gap of people that don't qualify for Medicaid, can't afford ACA. HealthNet's here, for that purpose. But yeah, so we're kind of expanding services like that too.
Is through the continuum of care, are you guys involved? Is that one of the groups that's involved with the annual point in time, the PIT count? Yeah.
And it's going to be this year or next year, January 25th. January 30th of 2025.
Okay.
It is a snapshot. It is. It just reflects just that a point in time.
Yeah. Yeah.
It is a lot of fun.
It really is.
We do get to see things that you normally wouldn't see. The first time that Crystal and I went out together, it was her first time going. We have great support with the police departments,
sure.
And they take us.
Yeah, I knew that. Yep.
And
but you don't know what to expect, right?
Well,
first
we had
time.
to go into a camp, and it was abandoned encampment, but the police officer was in front of us, and he's like, "Well, there's a mannequin head up here." And now, mind you, if we had been on our own,
that's not funny.
we would have come out of our skin.
Yeah, if you come across that in the woods in the dark.
Mm-hmm.
Wow.
Yeah. But it's very interesting knowing and seeing, and you go home at night. I can speak for myself. I go home at the end of that night, and I'm very, very thankful.
Oh, sure.
And
it does change your perspective.
It does.
Any involvement like that.
And it continues to stoke the fires in me, so to speak.
Yeah.
To continue to do what we do.
Well, something simple that helped, my involvement with United Way specifically is I became aware, for better or for worse, I became aware of where a lot of these encampments are. Because oftentimes several of them, I was driving by all the time, but just didn't have the awareness. But now I know where to look and what to look for. And it's just interesting. I'm not sure why I brought that up other than getting involved. It makes you aware.
It does.
Of some of the things that I was oblivious to.
Right. 15
or 20 years ago.
Exactly.
I just living my life and
And anyone can volunteer for the PIT count.
Absolutely.
Barbie actually does the training for
okay,
the
well that's good. That's good to know. Might be a listener out there who might have an interest in that's a later question is what are your current needs and stuff. So we'll make sure to cover that. But is there, before we kind of shift gears briefly, is there anything I haven't asked that I should have asked? Anything you want to make sure our listeners, but I'm giving let me be clear before we finish, we'll make sure they know how to find information out. Again, contact with you guys. What are your current needs? That kind of thing. We'll make sure we cover that before we finish.
Well, I think one of our greatest accomplishments is our website for the continuum of care, glcimpact.com. Anyone can go on there and find information about what's going on, our agency, our partner agencies.
Yep. And you can link to it from the HealthNet Gaston website
sure
too.
Can.
That's how I found it yesterday when I was doing a little research.
You sure can. And I think that's
okay. No, it's good. Yeah, that's great. It is a great website. Yeah.
We're in the process of kind of redoing our HealthNet Gaston website too. So that's in the works. But then also we have the Western North Carolina Youth Homeless website.
Okay.
So that's another link that should be on the Continuum of Care website. I have not put this, very new. I have not put it on HealthNet Gaston website yet. But
that video, I don't know how long that video has been on the HealthNet Gaston homepage. But that's it's a good video that gives you a really, 2 or 3 minutes to give you a really good snapshot of, because we're so visual these days, right? Reading some long things, people just don't do anymore hardly. So it's, those kind of things are helpful on these little, we love these little 2 and 3 minute video snapshots of things to learn about something. So yeah, it's good to kind of see that. So something we do here at Gaston's Great, we make our guests endure these Gaston County related questions, or maybe they're not Gaston County related, but we do them anyway. And so we also come up with a name each episode for this speed round of questions. And at the moment, we're going to call it the, we're going to call it the pit count speed round of questions.
Okay.
I really come up with some creative. So, Crystal, you're closest. So you're going to be first.
Okay.
So what is, and this is also, I want to make clear, and this is what all your coworkers, family, this is what they all want to hear and know about, right? For you guys. So this is super important. So what's your favorite Tony's ice cream flavor? Have you ever been to Tony's, I should ask? Oh, okay.
So our office is right across the street.
Well, I knew that.
But no, chocolate.
That's my answer, and that's probably the most common answer in it, yeah, because it's something about that chocolate milkshake is special.
I know.
Barbie?
Butter pecan.
Butter pecan. You know what? Chocolate, butter pecan, and are surprisingly common answers.
I hear people say grape too.
Yeah. So how about Sundrop or Cheerwine?
Diet cherry lemon Sundrop.
Okay.
Diet Sundrop.
All right. Crystal, favorite local restaurant?
The Web, of course.
Web is good.
Yeah.
Me? It depends on what I have a taste for.
What'd you say? I'm sorry.
It depends on what I have a taste for.
Okay, that is an unacceptable answer. On Gaston's Great.
I do like the Web.
Okay. And you can't copy the other guests.
I do like the Woodshed, which is in
Stanley.
Oh,
yeah.
So
it's been a long time, but that's some legit prime rib.
Yes, it is. Yes, it is.
So my mother is from Lucia, her family, up between, I guess that's between Stanley and Denver. And so, yeah, I've been to the Woodshed a few times. Yeah. Barbie, stick with you. Favorite outdoor activity in Gaston County or favorite park?
The Fuse Park, of course, because
that's cool.
I like taking my grandchild and my grandson. He's a baseball player, and he likes to
very good.
go to those kinds of
Oh,
games.
yeah, again, baseball's cool.
So I have the same answer, the Fuse, and just because we're big baseball fans.
All right, very cool. Yeah. So here's the question, and just for the record, there was some cheating going on before we started recording, but I'll start with Crystal. UNC Duke or NC State? Or
Georgia Bulldogs.
You're a Bulldog.
My daughter she went to Georgia.
Okay.
Yeah, so that's really why we're Georgia fans. But if I have to pull for one of those, it's UNC. Sorry.
Oh.
My husband's a Duke fan. Does that count?
Worse. Jeez.
Yeah. Sorry, no NC State.
Barbara, you got to save us.
Clemson.
All right. Well, Clemson and NC State are extremely similar schools with their academics and other than football programs aren't very similar. But you picked up Georgia and Clemson in football. That's about the two best football programs around here. So we're going to move on since nobody had the correct answer on that one. So Barbie, I'll stay with you. What is something very few people know about you?
I've never flown in an airplane. Ever.
Really?
But I have flown in a helicopter.
Okay.
Twice. Yeah.
Were you running from the police in a helicopter? What were you doing?
No, it was sightseeing.
Okay. That is unusual. I would say helicopter riding, but never in 2024, never ridden in a plane. That's interesting.
Never, ever. And my mother was the first one to get me on a helicopter.
Okay.
And my grandson wanted to go up in the helicopter.
That's interesting because I've flown all over the place, but I've never been in a helicopter. So.
Yeah. But I'm claustrophobic. But I have been told that flying in an airplane is like riding in a bus. Okay.
That's fair. Yeah, that's probably depending on the type of plane and size of it. That's with a lot of potholes potentially.
Yeah.
Big potholes sometimes.
Yeah.
Crystal, how would you answer that one?
So I guess I would say I used to be a runner. I used to be in shape. But I've ran 2 full marathons.
Wow.
And 15 half marathons.
Oh my goodness.
So yeah, that's been
Where were the
last one.
full marathons at?
Greenville. Both of them were in
Okay.
Greenville,
South Carolina?
Mm-hmm.
I'm a runner, but
Yes.
I sure haven't done that. And I'm
The
running.
Swamp Rabbit Trail. Have you been on the Swamp Rabbit
I have.
Trail? Yeah. So a lot of those.
I sure have.
Those 2, the Swamp Rabbit Trail was a big piece of it.
Okay, that's cool.
So,
Yeah, I'm in a group called F3 here.
Okay.
And we there's a relay race that goes, it's called the Ville to Ville. It goes from Asheville to Greenville. And
Okay.
part of that relay is on the Swamp Rabbit Trail.
Rabbit Trail, yeah.
That's cool.
Yeah.
In fact, I got one of my sections that I ran was on that. So,
yeah.
well, that's excellent.
That's
Well, yeah, that's unusual. And good gracious, 15 half marathons.
Mhm.
Wow.
Yeah. And they were just
That
different
makes my
places.
3 sound paltry, pitiful.
Well, I ran for a long time.
So how
Several
about
years.
a book or article or another podcast or something you might recommend to our listeners?
I was attending a nonprofit, a leadership, not really conference, but class, I guess. Actually, United Way sponsored it. Andrea, It was something that she's doing. And then, so there was a book by Jonathan Sheik, I think is how you pronounce it, who is an author, but he's also a leadership consultant. And the book's called, The Nonprofit Secret. Yeah. And so it really focuses on 6 principles of a successful board and like executive director or CEO relationship. But
That's interesting.
It's really good.
Cool. Barbie, how would you answer that question?
Mine's a little bit different.
Sounds intriguing. Where's this going?
Well, I think that we all need to get back into our Bibles.
Okay.
It's just my opinion.
Typically, I say that's an unacceptable answer because we would consider that to be the first answer for everyone. But that's just me and Naomi personally. But that's good. Yeah, I mean, I'm currently doing it chronologically with my wife. And we just got through the Gospels. Gosh. Sad. But anyway, no, that's a great answer. And I do appreciate that greatly. So we appreciate greatly you letting us or making you endure those Gaston County questions. And typically what is something that very few people know about you always has some unique, and those were 2 firsts. Haven't had anybody talk about running marathons or never flying and getting on helicopters. So
that's good.
Yeah, that was good. So a few more questions, and we'll get this episode finished up for you guys. So, remember, this is a podcast about Gaston County. Why Gaston County is such a great place. Of course, I'm a total homer for Gaston County, but Barbie, I'll stick with you. Besides HealthNet Gaston and the continuum of care and everything that you're doing, why would you say Gaston County is such a great place?
Well, twofold. Demographically, you're surrounded by
It is nice, yeah.
Great scenery.
It is. It's you
You
I
can
think
go
it's a
2
unique
hours or an hour up the road either direction, and you're seeing something different. Something, and the people. I think the people in Gaston County are caring and giving and want to be able to help.
Yeah, that's been my experience as well. Crystal, did you steal your answer? Or you got
I
some?
was just going to say the collaboration between a lot of the agencies, organizations here in Gaston County. I mean, I feel like us doing what we do, we see a lot of that collaboration and working together to help people.
And I think my experience, I think I joined my Rotary Club in 2000 or 2001, maybe. And so I think I've seen that kind of improve over that time period. Not as much, not as much posturing for your own organization, more about the mission and how we can just improve the community in general. So I appreciate that's 2 great answers. So Crystal, I'll let you answer this one first. I think I say this at least every other episode. This is my favorite question. So I know it's just been a couple years ago. Knowing what you know now, what advice would you give your 20-year-old self?
listen to what your parents tell you, because it comes back. You think about it, and it's true. I mean, normally they were always right. And then too, I would say, don't think you have to have everything figured out or mapped out, because it takes time to figure out.
The things we think were a big deal at 20 just sometimes were not a big deal, were they? So
Right.
I appreciate the other one because my children are 25, 23, and 18.
Mm-hmm.
So it feels like the older two, we are actually, my wife and I are back to being smarter by the day. Where there's a time period, at least I don't know about your experience with our kids, we were getting dumber by the day.
Mm-hmm.
And so it's interesting that you say that, because I do believe that. And gosh, yeah, if I had listened to my parents more when I was 20, I could have eliminated some pain and agony.
Exactly. Yep.
Barbie, how would you answer that one?
It's not about the money.
Oh,
It's more about growth and being a good human being.
maybe we should just stop the podcast after that one. That's a
That's a tough one.
it is. That's a mic drop too. So, isn't that ultimately too what we want for our children to just be good humans and good. It's not about they say things like, I want them to be a Major League Baseball player or whatever. And that would be nice if I can live vicariously through them more. But it's more about contributing to the community, being a good human. How do they treat people? Yeah.
Right.
How do you impact others? I mean, that's ultimately the purpose, right? Is because we have these interactions and opportunities every day, and sometimes we don't recognize when those opportunities happen.
Right.
All right, so listen, this has really been good, and I'm grateful you guys have taken the time to talk with us. So, again, remember the main point is to bring awareness. There might be somebody listening who's not familiar with the organization, who hears something they want to help. So where can listeners go to learn more, find out more? What are your greatest needs? Contact you guys, just anything and everything you can share.
So we have our HealthNet Gaston website, and there's some links on there for the continuum of care.
Right.
And then we're getting ready to add our homeless youth, that website on there as well.
Okay.
And then you can always contact our office. We're located across from Tawny's Ice Cream, so that's easy to remember because you can walk in and ask about services.
Okay.
And that's at 613
Yes.
West
East.
Franklin. East Franklin. No, it's West Franklin. 613 West
Is Broad
Franklin.
Street? Is Broad Street the where it changes?
I think it does.
I don't remember.
Yeah.
Or 321. I don't remember.
Oh, it's the East.
This is East Long Avenue.
Yeah.
Okay,
So,
so
I
it's
think
probably
this
is.
side of Broad or
Yeah.
I don't really
Yeah. It's
know. I'll
east.
take your word for it.
Yeah.
She would know better than me.
So is something like the pit count, is that a volunteer opportunity
Absolutely.
or any other things like that goes on or?
Yeah, absolutely. And that information is linked on the glcimpact.com,
Okay.
which is the COC website.
Awesome.
We are in the planning stages right now. Also,
And that's typical. Is that a 1 day thing? Is it multiple days? How does that
excuse
occur?
me, you do have to do the training.
Right.
That's a requirement. And so it could be, just a hour or so for the training. And
Okay.
then you're looking at, we could always use people. If you didn't actually want to go out into the community and actually physically count people.
I think a helicopter's flying over, by the way.
I
That's never happened that I'm aware, that I recall. And it's because Barbie has flown on a
Yes.
helicopter.
Yes. But you can always volunteer to pack bags.
Okay.
Because we do have, folks who donate, and donations. We will take donations as well.
Okay.
Socks, underwear.
Flashlights.
Is that, I heard from, I can't remember who we were talking to several years ago through United Way, and yes, socks is something that came up as a really big need that gets overlooked sometimes. Is that still the case?
It is, and underwear. I think now that there's a shower unit that is available,
That makes sense.
underwear,
Stuff we wouldn't think of, right?
Exactly.
Immediately.
Exactly.
And those donations are going to be, United Way will be our drop zone, I guess you can say,
Okay.
For those donations. And it will be advertised whenever that starts, where they're able to go ahead and donate.
One thing I want to put out there too is that we're not allowed to hand out tents.
Okay.
Tents.
HUD.
Yeah, that's a HUD thing. And one thing or a couple of things actually that have been requested by the folks, the homeless folks, maybe a game chair, keeps them from sitting on the ground all the time.
Right.
Or a little
That's a good idea.
little cart. I know that if you've been around and you see them pulling, grocery cart or pushing
Shopping cart is what you typically see, right?
Yeah.
correct. Just something a little bit, more manageable.
Oh, yeah. Yeah.
But yeah, that would be great. Volunteers are always great.
Okay.
And volunteers for the laundry shower unit.
Mm-hmm.
So our office, you can contact our office if anyone would be interested in that.
How is that typically? Is that something that, say, you're utilizing at Bountiful Blessings? Is that an example? What other kind of schedule is that on, or is that?
So we're in the process. We have one other event. We've just really rolled it out.
Okay.
Gaston County's really just rolled it out. But we have one other event planned for Saturday, November 23rd.
Okay.
That is at, I'm trying to remember the name of the church. It's across from, it's on Franklin. I'll look back at the name. It's an event that they do every year. And then we don't really have anything else scheduled, but organizations can reach out to us if they're going to have an event.
Okay.
Where we can, and they're interested in that, then
All
we
right,
can
cool.
provide that.
And it's a lot of fun.
Yeah, it is.
It is. It's a lot of fun. I think our staff has building trust is a biggie. And when you have folks that come every week knowing that they trust you,
Yeah.
and that,
There's no ulterior motive in what you're trying to do.
that's correct, and that they can count on you being there. And
It's rewarding.
it is very rewarding.
Yeah.
And they want somebody to talk to.
And without judgment.
Absolutely.
Exactly.
Absolutely.
Yeah, that's the big thing.
Yeah, us humans really like to do that, don't we?
Yeah.
So, well, this has been great. Any last words or any final comments before we close this episode out?
I don't think so. We appreciate you having us, helping us get the word out, about what we can do, what
Sure.
we can help with.
Again, well, we appreciate it.
Yeah.
It requires dedicated, passionate individuals within organizations. We talk about sometimes organizations too much, but ultimately it's the people within the organization that are boots on the ground, getting the work done. If nothing else, I've learned in the 25 years or so that I've really been involved in the community it's the people. And we do, to your point, we do have good people here that care. And there's a lot of them doing really good work. And we've got 142 episodes. Well, there's a couple episodes that don't share that, like our Halloween episode. But the bulk of those episodes is sharing about organizations and people who are doing that kind of work, the kind of work that you guys are doing. So, it makes our community a better place. So I appreciate that.
One last thing that I would like to say is that community service is not just from 8 a.m. to 5 p.m. Community service is a 24-hour, 7-day a week. And if everybody would just, think about that.
Sure, that's fair. Absolutely. So that's a good point. It's not always on our calendar, right, in our schedules.
Right.
So something I do, and I'm doing it again today, is I do have my own book recommendation or something for the week, or a podcast recommendation, and a quote or thought for the week. And this week I'm going back to an author I've shared multiple times, a gentleman named John Gordon, who I really like, and I would encourage you to follow him. But he's wrote a lot of books, but one I like is, and it kind of can go to our, I think Barbie talked a little bit about perspective and how it, her community involvement has helped with being grateful, right, to go to what we do have. But he wrote a book called The No Complaining Rule, Positive Ways to Deal with Negativity at Work. So his book was specifically about dealing with negativity at work, but frankly, it can be utilized to for anything that you're involved with. And it's, I saw you writing this, it's Jon Gordon. So he's somebody that I follow, and he has a weekly podcast that I listen to as well. So my quote and thought for the week comes from Henry David Thoreau, and it's pretty. I think Barbie also talked about trust, right? And this, I think, ties into that. But I would say it's about honesty and integrity. But Henry David Thoreau said, be true to your work, your word, and your friend. Ultimately, our word and our reputation individually might be all we have when you're dealing with other people and other things. So just keep that in mind. I think that's a good one. And sounds simple. Simple and easy don't always go together, but yeah. So to our listeners, thanks again for taking the time to listen to today's episode. And please continue to spread the word if you can about the podcast. And please don't hesitate to contact us here at our email address, which is podcast@gastonsgreat.com. We're always looking for suggestions for future podcast topics and guests. You can find the podcast and subscribe at the website, gastonsgreat.com, or anywhere you listen to podcasts. Please follow us on all our social media platforms. Apparently, according to Naomi, getting us a good 5-star rating helps the podcast get noticed as well. Thanks again to Crystal and Barbie for being our guests today. Gaston's Great is produced. I'm going to stop for a second. I just remembered something. So do we need to make any announcements about this Thanksgiving episode we're trying to do? So we're trying to get feedback on what people are grateful for here in Gaston County in general and share some of that on a Thanksgiving episode, which is just a couple weeks away. And I know we've got to post it on the GSM social media, the Gaston's Great social media. But is there don't we have a phone number? So we actually we've created a phone number here, 980-745-8115. 980-745-8115. That's going to go directly to a voicemail where anyone can leave just a short message about something that you're grateful for or thankful for. And Barbie just had some kind of episode over there.
I'm so sorry.
I think it was a sneeze. I don't know.
I was trying to hold it in.
Oh, that's good. That's how we roll here. And this, for the record, we edit nothing out, too, by the way. Barbara, that's a terrific way to finish this episode. I'm sure she's grateful that I pointed that out for her. So, but we've started on some holidays, trying to do something a little different. And so, again, you can email us at podcast@gastonsgreat.com, or just reply, I guess, in the messages for any of our social media. So, sorry that I just blew this into this episode up. So, as I normally finish with, Gaston's Great is produced and brought to you by Naomi Hunt and Amy Anderson and Barbie Sneezes from GSM Service. I'm your host, Stephen Long. Thanks again for hanging out with us, and please keep coming back to hear more reasons why Gaston's great.